Fran and I are happy to be here in Darke County, and today we're going actually to 4 different locations where shots are being given. And the one thing that we notice everywhere we go is that people are really happy. They're happy to get the shots. They're happy to move on with their life. And there's really, I think, a real sense of relief that people have in regard to this. So this is a very impressive operation. This is really the community coming together. We also have the National Guard here as well. The Guard has done a great job throughout this pandemic, working in food banks, delivering food. They've also been involved in doing the testing, a lot of the testing that's been done around the state, and now of course they're involved in regard to the vaccines. But when Fran and I just walk through here, it's just very impressive. So many people working so very hard. Now, you want to give them a little rundown of what you guys are doing here?
Absolutely. Thank you.
Kind of numbers and things. I'll let you step up there.
Thank you both for coming. So we have the National Guard here today doing 400 doses of first doses of the Moderna vaccine. We run 100 people through here in an hour, so we'll be done around noon today. This is a collaboration of the Darke County Health Department, Family Health Services, and also Wayne Hospital. So a huge thank you goes out to all 3 agencies just for the collaboration and the support that they've all given us over the last year of this pandemic. Thank you.
Anybody else?
Sure. I'd like to add, through the collaboration with Reid Hospital, they've been able to provide the space for us that we've been using as the spot where we've been able to deliver all these doses. I think we're up to 7,600 doses that we administered through yesterday, and through today we'll get up to 8,000. So it's a wonderful collaborative effort, and it's worked wonders for our population, and we just hope to continue and help dispel this issue once and for all, sooner or later. So thank you.
Anybody else? It's a bashful group here.
Yeah. They summed it up great.
Yeah. So maybe to share some statistics. I looked at Darke County coming in, and sometimes the data is a day or 2 behind, so this may be behind, but we're showing about 17% of the population in Darke County has been vaccinated. It's probably a little higher than that. There's always a day or 2 lag in regard to that. So that's pretty good. If you look at those 80 and above, Darke County is right with the rest of the state. 2/3 now. We crossed over 2/3 of those 80 and above. So the older people are, obviously, the more vulnerable they are. And throughout this pandemic, throughout the time that we've had the vaccine, we've really focused on trying to protect lives. And we've used age as the best indicator. So if you look at those 65 years of age and older, that represents 87% of the deaths in the state. If we now are open to 50 and above, that represents about 98% of the deaths in the state. So we've had a lot of discussion about how we do this, but age is just the best indicator. And we still have a scarce product. We still have to kind of ration it, but we're moving forward. And I know the president talked about May 1 as a time when he would hope that everybody in the country would be eligible. We're certainly well on track to be there. I suspect we'll be there before May 1, where we'll be able to open it up to anybody in the state. So we're happy to answer any questions about what's going on here or anything else. Anybody in the media?
Thomas Kevin. Eric Martin, I'm with the Greenville Daily Advocate. We're glad to have you here today.
Thank you.
I just saw that Jenna Powell has introduced legislation to get rid of the mask mandate. What are your thoughts on that?
Look, this is a mistake. It would be a mistake to do that. We're like, I like the sports analogies. We're driving. We're down the 5-yard line of the other guy, and we're ready to go score, but we can't walk off the field now. We can't stop right now. And we need to play defense for a little while longer with these masks. These masks work exceedingly well. The reason that we are in the position we are today is two things. We have the vaccine, which puts us on offense, and we're driving hard with that. You see so many people in the community working hard every day to get more shots in. But at the same time, we've got to continue for a little while longer to play defense. We've learned a lot from our schools. Schools have, in the rural parts of the state of Ohio, have stayed open, by and large, and they have not had much spread directly in the classroom. In fact, we actually did a study where we had 7 different schools and we tested, and when we had students who turned out had COVID, and we tested to see if people around them, students around them in that class got it, and they didn't. And the reason they didn't is they were wearing masks. So the masks have just been very, very powerful. We can't quit now. We got to finish the game, and it won't be too much longer. Then frankly, we're going to be back to normal, and we get back to normal by more and more people getting their shots, and by keeping the mask on until we drive this virus down.
Do you have a target date for when things are going to go back to normal?
Well, we've set a goal, and the goal is 50 cases per 100,000 population every 2 weeks. And that's a metric that is a standard national metric as far as measurement. Not every state has set it at 50, certainly, but we have set it there. And we base that on what epidemiologists told us, and they figured by the time we got to 50 and below, we would be able to take off the health orders and move forward. So we look for this summer for the Great Dark County Fair to be a full fair. We look for parades to occur, Annie Oakley celebration and other things. Look, Dark County is going to be back to normal this summer. And we just got to, but we got to keep going for a little while longer and drive this and just follow the science, follow the facts, and we'll get there. Anybody else?
Can you give some more details on your tour? You said it was a happy group.
Yeah.
Maybe, I'm sure you met.
Yeah, here in Dark County, this has been really a great effort by the community. So many people it takes to run a big vaccination site like this and to make it run smoothly. And the community has really come together. One of the interesting things they told me is that some people will come in and get a shot and then say, hey, I would like to volunteer. And that's a real tribute to Dark County. It's a real tribute to this part of the state. People pitch in, they get the job done. I think as Fran and I talk to people, it was just a real sense of relief. They're happy. It's not too often that you're talking to people and they're happy to get a shot, but people are happy to get shots. They're happy to get this behind them. They're happy to go hug their grandchildren and be able to go to ball games and all the things that we can do. Anything to add? No.
I shared with a lot of them the photos of our 2 grandbabies that were born in November, and I think that's what a lot of people want to talk about. I get to hold and hug my grandbabies. I get to see my kids, and I think that's just really important. People want to get back to normal, and this allows them to do it. So
this is
people are ready.
This is our ticket back. This is how we get back to normal, and we just got to drive this virus down. And the more people who get it, the faster we can get it out, the better off we're going to be. So when you ask the question, when you get back to the question, when, it's really when we're going to get back totally to normal. It really depends on how fast people will take the vaccine, how willing people are to get vaccinated. Because we have to hit that herd immunity, and it's going to just take more and more people who are willing to be vaccinated. That's how we get back.
And I wore my copy of a World War II pin for victory, and I say take the vaccine for victory over this virus. So that's important.